It is a problem that is lurking virtually everywhere in American society, in our families, our schools, our communities. And it is on the rise. Addiction affects everyone, from young to old and across all races and socioeconomic levels. With recent statistics showing that 1 in every 8 Americans has a significant problem with drugs or alcohol, addiction has become a national crisis. Often compounding the problem is mental illness. Research indicates that 40% of addicted adults in the U.S. also suffer from some form of mental disorder, making an already difficult problem even more challenging.
The state of addiction in America today is quite serious. I'm particularly worried about teenagers and young adults. We're seeing dramatic increases in abuse of prescription drugs in this population. So, for example, almost 15% of high school seniors report that they abused prescription drugs in the past year. What are the ramifications of this? Well, we know that the earlier someone starts abuse of substances, the more likely they are to develop a substance use disorder, and they will battle that disease for the rest of their lives. We know that when someone develops a substance use disorder, they're significantly more likely to experience depression, anxiety, schizophrenia, or another mental illness. And once those two illnesses, mental illness, substance use disorder, coexist, the course of the two illnesses are often much more severe and much more challenging to treat. And now that we recognize co-occurrence of these illnesses, we are now experiencing the challenges of treating two very serious illnesses at the same time in one person.
Whether it's for substance abuse or mental illness, receiving treatment is the most vital step to recovery and living a productive life. Yet, nonprofit mental health and crisis agencies have seen a significant drop in public funding, despite an urgent and rising need for these services.
We now recognize that substance use disorders and mental illness commonly co-occur, and so we've created integrated programs to treat the whole person with all of the diseases under one roof, and that's the good news. The bad news is we're providing this care in a climate in which our budgets are being slashed and resources are quite limited. Patients, their families, and providers all feel it, and it's very challenging.
Mental health and addiction services in the United States today face the same problems facing our entire healthcare crisis. We see an increasing need for services among all people, especially children and adolescents, and yet the ability to provide those services remains a huge challenge due to the economic downsizing that we're seeing and the fact that the states can no longer support programs the way that they used to. So the challenge for us is to provide more and more services that we know help people in a downturn in the economy that prevents us from providing those services.
Successfully helping people who suffer from addiction and mental illness, the Brien Center for Mental Health and Substance Abuse in Berkshire County, Massachusetts, has taken a unique approach to rehabilitative services. Created 90 years ago, the Brien Center has evolved into a multifaceted and integrated agency that is now the largest provider of mental health and addiction services in the region. Built upon the vision of former President and CEO Ray Brien, the center employs an innovative community-based approach designed to get people into the path of recovery as soon as possible.
The Brien Center offers services that range from early intervention for children of up to 2 years of age to tracks that we have that deal with geriatric patients. So we offer integrated mental health and substance abuse services for all ages. These are comprehensive services that include community-based models, residential models, crisis models, transitional services, urgent care models. In other words, if you're an individual, a man, a woman, a child, or even a family, and you come to the Brien Center, you can have all of your services done, integrated with all family members, and really have a much more comprehensive approach to treatment, well-being, and hopefully recovery.
The Brien Center offers a huge array of treatment options. So when a patient comes to us asking for help, what we do is we listen to them, we perform a full assessment, and then we partner with them to create a comprehensive treatment program. And what we're able to do is take that menu of treatment options and pick from that menu to create the most efficacious treatment for this unique individual. We really want to address all of their illnesses, all of their problems under one roof, the Brien Center roof. And I think that's unique and special about the Brien Center.
Serving over 10,000 people each year at 38 different sites within Berkshire County, the Brien Center's 550 employees provide support that helps clients stay in their jobs, learn necessary life skills, remain productive members of their community, and ultimately lead healthy lives. Treating alcoholism, drug addiction, eating disorders, mental illness, depression, and victims of abuse, the Brien Center believes healthcare is a right, not a privilege, and never turns anyone away who seeks help.
The Brien Center's mission statement for the last 90 years has been to take care of all people in Berkshire County who have mental illness or addiction. We take it very seriously, and we are committed to doing that so that we leverage all of the funding that we have together so that the uninsured and the underinsured in our state will still be able to receive services from us. As the sole provider of many of these services in Berkshire County, we know that without our help, many people will go unserved. So the mission statement is a firm part of everything that we do. It's the philosophy of our treatment centers, it's the philosophy of our clinical care, and it certainly is the desire of our board of directors that we carry this forth.
I really hit rock bottom. I lost everything.
I was sleeping in the park.
I had nowhere to live. Had no money, had nothing at all.
I didn't have custody of my child, my daughter, no money. I was just at my lowest.
Well, after being addicted to prescription pain medication, I went into treatment after 12 years, and they introduced me, referred me to Dr. Michaels in the Brien Center, and I joined the day program, and with people of my peers, learning how to get clean and stay clean. And then I was introduced to the Suboxone program through counselors and seeing Dr. Michaels, and I started the program almost 4 years ago, and been doing great ever since. If it wasn't for the Brien Center, I can't say that I would be alive.
The Brien Center helped me get on the path to recovery in many ways. First, they set me up with counseling, and I was introduced to Dr. Michaels at the Brien Center, who pretty much introduced me into reliving a normal life. I didn't know how to live before I met Dr. Michaels and was a member of the Brien Center, and I started on the Suboxone medication, and I'd see Dr. Michaels frequently, and I still take that medication today, 6 years later, and I can't say that I would be here without the Brien Center. The Brien Center has been the backbone of my recovery, and I'm grateful for this whole program. I don't know where I'd be.
While the Brien Center treats clients of every age, it has taken a special interest in the care of children. Serving 4,000 in Berkshire County annually, the center is determined to do more with early intervention and prevention services in a mission to prevent another generation of children falling victim to the nightmare of addiction and mental illness.
The Brien Center has been providing services for children and adolescents for over 90 years, and that in itself makes us a real groundbreaker in children and adolescent services. We know that the sooner we can reach a child and help a child with early intervention and prevention, the better chance we have of that child becoming successful in school and eventually in life. The Children's Behavioral Health Initiative, which is a new multi-million-dollar contract awarded by the state of Massachusetts to the Brien Center in 2009, provides an array of over 7 different services that actually change the way we deliver services to families and produce sustainable changes in a family's life and a child's life forever.
The Brien Center has helped me on my path to recovery to overcome a very traumatic childhood. I was physically abused, sexually abused, and emotionally abused throughout my whole childhood. They have gone above and beyond to really help me to understand the disorders I have and how to deal with them. They also have helped my son understand the disorders that he has had and how to overcome them. They have gone above and beyond, and they have been very crucial to both my son and myself's recovery. What I love about the Brien Center is they are very caring and understanding people, and you know that they're not in it just for a paycheck. They really do care. They really do go above and beyond to help you towards recovery.
In an effort to provide more efficient and effective services to people in need, the Brien Center has recently completed the purchase of Mount Carmel Parish and its surrounding buildings. Home to the new Brien Center campus, the location will consolidate many of its most important services into one easily accessible setting, helping to provide treatment, care, and hope to even more residents of Berkshire County.
The acquisition of the Mount Carmel Parish will enable the Brien Center to develop a central location that we've named the Brien Center campus so that people can walk from building to building and access the different services that they need, both for mental health and substance abuse services for their families. We intend to move several of our exciting new contracts to the Mount Carmel Parish, including the Children's Behavioral Health Initiative and the Community-Based Flexible Supports Program. This will enable both parents, children, and individuals to receive services at a location that is both environmentally pleasant and easy to access. By being in downtown Pittsfield, we're making ourselves available to the entire community. It is a central location, and many of our clients can actually either walk or take the bus to services.
The new campus is just a small part of an overall effort to achieve one goal: to remove the stigma of addiction and mental health services. By bringing its work into the light, it is the Brien Center's hope that more people will realize that needing help is nothing to be ashamed of, and that most importantly, recovery is possible.
These illnesses are very common. Almost half of all Americans will experience some form of mental illness during their lifetime. About 15% will experience a substance use disorder. These are really common illnesses, and at the same time, society stigmatizes those people who suffer from them. And so what we see happening is the vast majority of people suffering from these illnesses never seek treatment. We're treating a minority of patients, and we're missing the boat, the opportunity to treat these vast number of people who have treatable disease.
The Brien Center, here to listen, here to help. For more information, please visit www.briencenter.org.